All right, YouTube. We're just waiting for Facebook. Let's get it. Hello, everybody. Recording live from somewhere. This is Zach Couples with episode number 6 of the Movement Debrief. Today we're going to discuss two topics today. I'm going to go pretty in depth into one. And this is a reader Q&A talking about how, when you are a new parent, you can maximize your sleep. The other one is giving patients ownership of their care. A little bit of housekeeping before we get going, and this will actually segue into question number 1 quite well. Go to the blog. This is zachcouples.com, where I write. I put out a new post on Monday, and it is about sleep, of all things. In particular, how you can maximize your sleep when you are sleep deprived. And the example I used was when I was in the D League last season, and we had the absolute worst schedule known to man. And we were able to work around it by making some tweaks. So, that's basically what I did this week. Let's dive in. First question. This is from Michael from Seattle. So he messaged me and he asked me the following question. Any good hacks for a new dad to get the max out of my sleep and still be able to function during the daytime for my patients? Thank you, Michael. First off, congratulations. Definitely a very exciting time to have a new child in life, but also very stressful, and a lot of changes have to be made when that happens on multiple fronts. I personally don't have any kids that I'm aware of, at least, and so I don't know what it's like to go through that. But what I do know is that babies tend to wake up quite often throughout the night, especially early on, and that can disrupt your sleep pattern. Ideally, we like to have a consistent amount of time during sleep so we can hit all the sleep cycles. And so what do you do when you can't do that? The best thing you can do in this case is to maximize every other thing that you can that contributes to getting a good night's rest. So what are those things? The first thing I will say that definitely helps with alertness is maximizing your circadian rhythm. And so obviously what that is there's certain points in the day that we are a bit more alert, and there's other points in the day, such as sleep, when we are less alert. It has to deal with hormones and many other things. The first influence that can help with alertness is sunlight. So get exposure to sunlight, especially earlier in the day. I'm trying to word this correctly. If you wake up at a consistent time during the day, or during each day, that will prime your circadian system to develop alertness. That can be enhanced by being exposed to sunlight early on, and typically early mornings are generally better for that. There's another cue circadian wise that a lot of people don't think about. We consider light and dark cycles being a central cue, but if you listen to some of Rhonda Patrick's work, who I strongly encourage you guys to do so, she's awesome. She's got a podcast, and I heard this on the Tim Ferriss podcast, actually. But food is a peripheral tissue cue for your circadian systems. And so if you eat earlier in the day, that can prime your circadian rhythms a bit differently as opposed to if you eat later in the day. And there's also some research out there showing that if you prolong your feeding duration, and that's basically anything non-water, so coffee included or tea, that can have influences on body composition, but also sleep-wake cycles. So another strategy you may consider is, if you're not eating breakfast, eat breakfast, something with a bit of protein and other good macronutrients. That's healthy, obviously, and have that earlier in the day. And you may push your meals so you're not eating so much when it's darker out. And that can be helpful if you keep your eating window to maybe anywhere from 8 to 12 hours. This goes a little bit contradictory to what some people argue in terms of intermittent fasting, aside from the window. But we also have to think about what other influences food can have. So, three things: get light exposure, eat a little bit earlier, and then the third thing would be making sure you try to be as consistent as possible with your bedtimes and wake times. Those are three things that can help prime your alertness from a circadian standpoint. The other thing would be strategic napping. There's a phenomenal book. I'm going to show you guys this. It's called Take a Nap, Change Your Life. You should read it. It will change your life. What this does, and what's like probably the coolest thing about this, is it's got this thing on the cover called a nap wheel. And so depending on what time of day you take a nap, you will hit different sleep cycles or different cycles of your sleep, because sleep cycle is influenced by circadian rhythm. For example, as you wake up, based on the way our hormones are influenced, the amount of sleep pressure that you get increases during the day. The more sleep pressure you have, the more deep sleep is going to be utilized. So like if you were to pull an all-nighter as an example, and there's a large amount of sleep pressure that occurs, you're going to be more likely to have larger amounts of deep sleep when you make up that deficit. On the flip side, once the sleep pressure has been alleviated and you're getting more sleep maybe earlier in the morning, you get more REM cycle sleep, and that's where you have the rapid eye movement and you get a lot of benefits from that. So if we time our naps in such a way, we can predispose ourselves to either getting more deep sleep or REM sleep, depending on what we do. So if we say like we have our nap cap, right? Because each sleep cycle is about 90 minutes to 2 hours. That's what I would cap most naps at. If you nap earlier in the day, and let's say we get up at, and I'll show you guys this on the wheel, 5 o'clock like I do. All right. This blue right here, that's how much REM sleep you would get depending on what time you nap. This yellow right here, where I got the movable wheel, that would show you predisposing to more deep sleep. And so if we hit this sweet spot in the middle, which the author calls kind of the golden mean of napping, you'll get a good balance of slow wave and REM sleep. So for me, like my ideal nap time would be at 12 to 2, because that gives me a balance of REM sleep and deep sleep. Now, if I wanted to help with a little bit of memory retention and be a little bit more creative, I could nap earlier in the day, and that would get me a bit more REM sleep, because that's what the research has shown REM has been helpful for. If I wanted a bit more tissue repair, say I got after it in the morning, I had a really good workout, then I might push my nap till about later, say maybe 3 to 5. Those would be 2-hour naps, of course. In order to ensure that you don't impact your ability to fall asleep at night, I would probably cap the time that you would wake from your nap to be somewhere between 3 or 4 hours from when you would normally go to bed. And so, like me, I try to go to bed between 8 and 9:30. I would probably at the latest end my nap at 4 o'clock. Now that's a 2-hour nap, and a lot of times that's not feasible in people's schedules except for maybe the weekends. If you can't get a nap that is that long, you still get benefits from naps much earlier than that. I would recommend, if you can get a 20 to 30 minute, that's probably the next best thing you can do from a restorative standpoint. That will help with a little bit of focus, retention, memory retention, alertness, all these types of things. But there's even research out there showing that you can get benefit from even a 5 to 10 minute nap. So really any type of napping is going to be helpful. as long as it doesn't negatively influence your normal sleep and wake cycles that we established. Let's say you are just shy of your bedtime and you know that napping would negatively influence your ability to fall asleep. What's another way you could increase alertness? Meditation. Meditation is phenomenal. I've used Headspace in the past. I've heard Calm is also great. There's a free app too called, oh man, what's it called? I will put it in the show notes tomorrow. But like any type of quick meditation can also be very relaxing and doesn't necessarily negatively impact your ability to fall asleep. In fact, it may enhance your ability to fall asleep. And if you're not a big napper, that's also another great way, maybe midday, to increase your alertness levels. So we talked about circadian rhythms. We talked about naps. The last thing I want to discuss, actually before that, let's go back to maximizing your bedroom environment before we get to the very last thing. So, bedroom environment. Are you making sure that you are doing everything possible so that the little sleep you do get is of most benefit? And so, what are the big keys to having an optimal sleep environment? First thing would be, if you guys are close to bedtime, why are you watching this? Get away from your screens if you can. Because what those do is those have blue light. And yes, I'll talk about the blue light blocking stuff. But those have blue light. And even if you are using blue blocking apps such as Flux, or you got the night shift on your iPhone, you're still getting light into the system, right? Or into the eyes. And that can influence. Sorry, I was reading Dave's comment. Awesome. I'm sorry that you are not getting the live video stream. I'm not sure why that is. Could be on my end because I'm in Arizona. Anyways, where was I? Oh, yes. So, getting rid of the screens. You are still getting light into your retinas, which can stimulate alertness, as we talked about with the circadian stuff, even if you have the blue light blocker. Right? Now, blue light's like the biggest one for alertness, but any type of light is going to influence our ability to stay awake. Now, if you have to be exposed to your screens, make sure you're using an app such as Flux, or you're using a blue light shades, which I'll show you what I got, some type of blue light blocker. I use these periodically. Dope, right? These will block out blue light, not just from the screens, but from everything, because lights such as like the one I have behind me can influence your sleep-wake cycles. I mean, it wasn't until last century that we had artificial light. And what did we use? We used candle lights. And so people went to bed earlier, got more sleep overall. These things too, these lights will influence alertness. So if you can block that out or shut the lights off earlier, that will be immensely helpful for you falling asleep. Other things, room temperature. You want to make your room as close to a cave as possible. So if we first talk about temperature, if you look at most of the research, it varies what they say is the best temp, but anywhere from 60 degrees to 67, 68 degrees is ideal. You want that sucker cold. Another thing to consider is you also want it damp. If it's too dry, that can influence your body temperature regulation as well as oxygen flow, or airflow, I should say. So if you have a humidifier, especially if you live somewhere dry like I do, get one. That will also help with your ability to fall asleep. Other things, you want this place pitch black. So get some blackout curtains, have the lights completely off. It also helps too if you got like light going through your door. I'm pointing my door there, which you can't see. Put a towel underneath the bottom so it doesn't seep through. Even if you have the the things that, gosh, I can't even think today, man. If you have the things that block your vision and you're wearing that, light exposure can still influence your sleep-wake cycles because your skin can react in such a way that will increase your body temperature if exposed to light. They've done a research study where they shined a laser on someone's thigh, and body temperature increased when that happened. An increase in body temperature is going to make you more alert because as we sleep, our body temperature decreases. That's one reason why you want your room to be a bit colder. So we talked about temperature, we talked about light, we talked about blue light blockers, other things, screens. Happy time. You know what I'm talking about, peeps. When you and your partner have yourself some fun, a nice cascade of various hormones that help promote sleepiness happens after the fact. So if you aren't doing that, you might want to consider that. So those are some of the environmental things. So we talked about environment, we talked about circadian rhythm, and we talked about napping. The last thing, and I am not an expert in this by any means, and I'm going to be parroting a lot of Rhonda Patrick and Mike Roussel, but supplementation. So what you may consider using to help with alertness, especially earlier in the day, is if you're not caffeinating, caffeine's a hell of a drug, man. This stuff works from an alertness level. You want to consume anywhere from 150 to 400. You can consume up to 400 milligrams per day from what I've read without any negative effects. You just want to be able to go to whatever your tolerance is. That said, caffeine has a half-life, depending on your physiology, of 3 to 9 hours. So you don't want to consume caffeine later in the day. That could be problematic because you'll have a hard time falling asleep. So caffeinate. The stuff works, man. That's one supplement you could take. I've also been playing a bit with some nootropics, and not like the smart drugs, but like nootropic supplementation. And some of this stuff, when you use it properly, can help with alertness and your ability to stay awake. Now, Rhonda Patrick, again, I'm gonna point to her because she has a podcast with Tim Ferriss, and because hang on one second, guys, my phone is starting to die a little bit. I want to make sure that doesn't happen. All right, so Rhonda Patrick's got a podcast with Tim Ferriss, and she talks about smart drugs and some nootropics you can take. A couple that I like. She doesn't mention this one, but my boy Mike Roussel does. And it's called teocrine. And basically what teocrine is it's kind of like caffeine. Caffeine works by the adenosine pathway, whereas teocrine works via the dopamine pathway. The cool thing about teocrine that we can contrast to caffeine is that caffeine has a effect that you get used to. Teocrine doesn't necessarily have that learning effect, or that habituation effect, I should say. So it's a phenomenal supplement. I've used it periodically when I need to, or if I've had an issue going to sleep, and it's worked pretty slick. You want to aim for about 150 milligrams per day. The brand I get is from Nootropic Depot. It seems to be effective. Another one that I've been kind of playing with lately, and this is one that Rhonda Patrick turned me on to, is lion's mane. I don't know much about it. Like I said, she would be the one to go to. But there's I don't know if you guys have heard of Four Sigmatic. That's FOUR-SIGMATIC.com. They do a lot of mushroom supplements, and I don't know what the efficacy of these is or is not, but I've been using their mushroom coffee with lion's mane, and this is another one that Tim Ferriss recommends. And lion's mane does have a little bit of research supporting it from a nootropic standpoint. But I'll put that in my coffee. And it doesn't have much caffeine. It's only got about 40 milligrams. But I'll tell you what, that stuff helps with focus, at least anecdotally from me. So I am a fan of that as of right now. Like I said, Rhonda Patrick has many more nootropics that could work, but supplementation might be a thing you want to use as a means of damage control when your sleep is impaired. I would recommend using a lot of those as a last case resort, and maybe cycling through them, because I think anything has a habituation effect to it, and loses its luster. And especially with caffeine, if you go off caffeine for a little while and then you go back on, I mean, the effects of that drug are unbelievable. So cycle your stuff. Another thing that we can do when we are new parents and are not sleeping well is catching up on sleep. Now, I know that this kind of goes contradictory to when I said go to bed at the same time and wake up at the same time, but there is a little bit of research showing that if you let people, I think this was a 2015 study, and this is from Mike Roussel, he turned me onto this study, but if you go to, or if you, like what they did was they allowed these men to sleep in on the weekend, and they measured many different hormonal levels that can have an influence on blood sugar. And when allowed to sleep in on the weekend, those numbers favorably improved. And we know that dips in blood sugar or large fluctuations can have an impact on your alertness or lack thereof. So, one thing you may consider is sleeping in on the weekend, or at least sleeping more on the weekends. This is kind of a trial and error thing that you're going to have to go through, because I do think, man, when I sleep in, I feel phenomenal. But also, it can screw up your sleep-wake cycles during the week. So you want to try to determine, and like I said, this is going to be an idiosyncratic, and I don't have any overarching guidelines, but you're going to want to play with how late can you sleep in that it doesn't impact your ability to go to bed at your normal time when it comes Sunday night, or wake up at your normal time. For me, it's about, I think the best I've ever done was 2 hours later than when I normally awake. This past weekend, I went to bed pretty late, later than normal, and I woke up about 3.5 hours past my norm, and it was a struggle to get back to bed and wake up at normal times. I kind of had to titrate myself back to my 5 a.m. So you're going to want to test yourself out and see which of these strategies is going to be best. So that was a long answer to Michael's question. Thank you for the wonderful question, Michael. And that's kind of what I would do if I was in a situation where I could not get my adequate sleep, such as if I have a kid. All right, the next thing, giving patients ownership in their care. So I got a patient story for you guys. So I was seeing this woman, and she was seeing me for left hip pain. It's been bugging her for like 6 months. And let's give a little bit of backstory on this woman. Didn't really have like any event that caused this, but this woman's been through some shit. She has 4 kids, works a job, and is recently a single parent because her husband passed away in the last year. And now she's dealing with this hip pain, and it's impairing her ability to do things for her kids. She doesn't sleep because she has to spend time with her kids, or she wants to spend time with her kids when she gets home from work. She doesn't eat well. She's obese. She's got a lot going on. And she was telling me all these things, and she was crying, while she was doing it, because her life is hard. It's hard, and that really puts things into perspective for I think all of us when we're going through stuff. And it's patients like these where she doesn't have any control in a lot of things in her life. And it's these types of situations where, as clinicians, we have expectations. I know we have expectations for our patients. We need them to do A, B, C, D, and E in order for them to meet their goals. And I think you can have a much greater impact if you let the patient have some ownership and some choice in what those values are. Now, in her case, look, if I give this woman 2 exercises or 3, and I say do 3 to 5 sets, 5 breaths, a couple times a day, like that's just not going to happen. That's just not feasible for her. So what I do in this case to provide her ownership in her care is I said, hey, I'm going to show you this activity. You tell me if this is feasible or not. I told her to call bullshit. If this was like, Zach, there's no way in hell I'm going to do this. And so what did I do for her? This woman never sits, so I gave her something in standing to do. And I said, hey, let's do this activity and maybe just kick out a few breaths here and there throughout your day. And a great one that I do for people is if I give them a standing activity, I say, hey, once you left the bathroom and you walk, or before you leave the bathroom after you've washed your hands, just kick out 5 breaths and get on with your day. And so she seemed cool with that. The other thing I did was I gave her some ownership in terms of when she could schedule her appointments and how often she wanted to see me. And I just asked what was reasonable for her. And I see a lot of patients where I'm at just based on the way the clinics run, either once a week or twice a week, and she elected for once a week. And because I did those 2 things, she's been immensely successful. Now, how many times is she getting her program done? She's getting it done enough that she's seeing some results. Is it perfect? No. She still has bad days, but those bad days are fewer. She seems a bit more at ease. She is doing more throughout her day. And I think most importantly, she has something in her life that she now has control over. And that's her pain. And I think that that's immensely impactful for this woman. And if we can do that for all our patients, I think the benefits supersede a lot of what we provide as healthcare practitioners. I've done that very scenario with, I have 2 patients right now who I'm doing that with, and I'll give you another example of how we can give our patients ownership. And this other woman, she has been dealing with a lot of knee trouble, had a major knee operation, and has anxiety through the roof. And there was an activity that I gave her that was very much problematic for her. And they came in, the next session was like, we're not doing that. And I was given a protocol by the physician. And they're like, we just want to, at this point, follow that protocol until we can have a conversation with the physician's office. I've had this happen before, and I think we've all had this happen before, where physician gives you a protocol and the doctor maybe is very adamant about doing it this way, or they've scared the patient so much that if they veer any way, shape, or form from what they were told, that we're going to run into problems. We've all seen variations of this same story. You want to know what I did? I did the protocol. Yeah, it was simple things, and you guys know me very well based on what I do. That, like, this stuff would be rudimentary physical therapy, but I did it because I knew that was the best thing for her. That was the way that she could get control in her life. That was the way I was going to get buy-in, and that was the way that we were going to get this woman's confidence level high and anxiety level low. And it's about checking your ego, getting that out of the way, and making sure you're doing what's best for the patient. You want to do what's best for your patient, your client, your athlete, not what's best for your agenda or your ego. And I think we'll call that it for tonight. Thank you for listening to episode 6 of the Movement Debrief. Guys, follow me on my website. Go ahead and check it out, zachcouples.com. I just got an acute to chronic workload calculator loaded up on that bad boy if you sign up for my newsletter. It's pretty dope. And I've been using it with a lot of my patients and like a return to run program. And I got another guy who I'm working with, a client, and I'm using it for his running program. And it's a very successful tool if you're familiar with Tim Gabbett's work in terms of reducing your odds of sustaining a soft tissue injury. So zachcouples.com, sign up for the newsletter. Otherwise, if you want to follow me with some of the social media jazz, please do that. Facebook.com/Zach Couples, or Z Couples if you're on the YouTubes right now. I also tweet occasionally. That's Twitter. My Twitter handle is @Z, my first initial Couples. I'm on the Instagrams. I take pictures of my hikes and stuff like that, but I also do some cool things from Rehab Lens. You'll want to check me out there at Zach, Z-A-C, Couples. Otherwise, you can subscribe to my YouTube channel. It's youtube.com/Couples Performance. Otherwise, you guys stay classy, keep it real, but not to the extent where things go wrong, and I'll see you next time. Take care.